Howdy, and welcome to the Confidence Through Health podcast. This is your host, Jerry Snyder. In episode 142, I bring you a conversation with John Gallucci Jr., who is a physical therapist. He's a medical coordinator for Major League Soccer. He's dealt with a lot of different professional athletes from various sporting areas. He works and is the CEO for JAG One Physical Therapy up in New Jersey, New York, and Pennsylvania. And we talk about the need for physical therapy. When do you know that you need physical therapy? How can you use physical therapy as a tool in your health, plan, health bucket? How can you use it to live pain-free and to manage the pain that you have as you have an injury that happens, whether you're an athlete or not, whether you get a work injury, whether you have just an injury at home because you tried to do too much, or if you're a weekend warrior, or an aspiring athlete. How do you know when to add that piece to the puzzle? How to find a good physical therapist that's going to work with you on the goals that you have. And we talk about different sports and how to how to prepare yourself for those things like pickleball, golf, different sports that you may pick up, running. And he has 2 books that he's written, and we talk about those a little bit at the end. And one that's on the way that he's excited about. And so I think it's a great conversation. I'm a big proponent of physical therapy. We talk about many different ways. He talks about 5 things you don't know that you're doing wrong with your body that will help you prevent injuries, that will help you get to a point where you can move continually throughout your whole life and not get to a point where later on in life you're just not moving as well, you're not able to function as well, you're not able to do your activities of daily living because your body just doesn't want to cooperate. And so there's a lot of things you can do in line with a physical therapist, whether you're injured or not, to be able to prevent those injuries that are going to be more catastrophic and take you out of the game for longer periods of time than you want to be. All right, so welcome, John, to the Confidence Through Health podcast.
I appreciate it, Jerry. Ready to jump right in.
Yeah. So to give a little bit of background, you're a physical therapist and you've had quite the practice and the experience in the sporting world, but physical therapy is both for athletes and non-athletes. I mean, it's for anybody that's dealing with something. But tell us a little bit at first about why, what was the passion behind it? What got you into it?
So that's an awesome question. So when I was a young kid, about 13, 14 years old, my mom and dad owned the surgical supply business in Brooklyn. Okay. And I used to deliver supplies, crutches, canes, wheelchairs to physical therapy centers. Oh, nice. And at a young age, I thought it was awesome watching a physical therapist take someone that couldn't walk and teaching them how to walk again and getting them strong enough to return back to work. And I got the bug then, and I haven't left the physical therapy world since. I've been in an office since I'm 13 years old, and nice. and I'm just about to touch 56. So I've been blessed and lucky to follow my passion, and I've been very, very lucky to live both in the sports world and the private world because I'm dual licensed, dual degreed in physical therapy and athletic training, sports medicine. So pretty fortunate.
And you've worked with some of the professional leagues. You're the medical coordinator for the MLS. You've got the experience with the athletes, which I think is great as an athlete myself. That I think it takes people that understand that, and what they go through. But having the non-athlete, just the person who maybe got tweaked their ankles stepping downstairs or something that and they need to come in. It's the same physical body, right? Maybe a little bit more fine-tuned in one case or the other. But how is that approach taken from the physical therapist standpoint to make sure that we're getting to the goals that we want to get to?
So that's great. So people have to understand everybody has goals. Let it be grandma that wants to bend down and garden in the backyard, to a painter that has to be working over his head all day long, to a fireman running up a ladder to save a life, to a professional athlete trying to score a touchdown or score a goal. So everybody has goals. And when I look at a patient, I look at everybody and take their goals and what they want to achieve. Perfect example is I learned from your background that you're a runner.
Yep.
There's nothing better than taking somebody with a passion to accomplish a goal, like run a marathon, and realize the trials and tribulations of injuries that happened during that time. And being able to help somebody get out over that injury and then accomplish their goal of actually running and completing the marathon, it's amazing. And we had over 100 patients last week at the New York City Marathon finish it, complete it. And it was astounding. It's like we were so proud that we were part of their goal. Right. And pretty much that's how you have to look at the physical therapy world.
Well, and that's a big piece of like for me as a runner, like my physical therapist is a piece of my team. Like it's a vital piece, because if I go out and I know that I could push myself a little bit harder and go through and like, oh, it's pain versus injury, like, okay, just deal with the pain, suck it up and go type of thing. A lot of us were taught as kids, right? You get hurt on the field and it's like, oh, just suck it up and go, walk it off. But that's not usually the best, answer.
Not the best advice, Jerry. We want to make sure that we're not limiting motion, because that causes increased problems. We want to make sure that there's full functionality of the joint above and below an injury. And we also want to make sure, and I always guide athletes and I guide patients. If you have pain, if you look at a scale of 0 to 10, 10 being the most pain, 0 being no pain. If your pain sitting around a 4 and 5, you need to stop the activity. You need to be evaluated by a physical therapist, a physician, an athletic trainer, truly understand what's going on and what's the best path for you. If you're trying to push through 5 to 10 at a score of pain, you're just putting yourself at more risk of injury. But the most important thing to tell your followers are you're going to miss time. And if you maybe step back when you're starting to feel it and treat yourself the correct way, you'll miss less time. Right. So that's what people have to realize. And I like that 0 to 10 score, and anything from a 4 or 5 or below, maybe you could get through. But if you're creeping 5, 6, it's time to shut down and get the right care.
Well, and yeah, you mentioned the big thing is in time and training, and and with training, it's a lot of times it's the same as with everything else you hear. It's like either you're moving forward or you're moving backwards. And yeah, and I've seen it myself. I've experienced if I hit that 5 or 6, and I'm like, but it's just one day, it's going to be okay. It always comes back to bite me.
It always comes back, and then all of a sudden you got to completely rest. The other thing people don't realize too is cross training. How important cross training is. And because you're a runner, everybody wants to just keep running. Right. Common sense. You keep pounding. Over time, it's going to cause an issue. But if you're rotating between swimming, biking, running, doing different things. I mean, I've got a dear friend of mine that's a marathoner, and when he gets to that last month, he'll tell you that he's at least 50% in the pool building up to the marathon, because he doesn't want the wear and tear and he wants to be able to complete it. And he's completed 8 marathons in the last 4 years. So he's doing he's doing 2 a year.
Yeah.
That's pretty impressive for a guy my age.
Yeah. Well, that's impressive for anybody.
Yeah.
But and so you mentioned cross training, and a lot of adults, and I think it's a common cycle of like, okay, you finish your high school sport or whatever, you're not a college athlete, you move on, then you get married, you have kids, and then like you get your kids start to get in athletics, and maybe you start getting that bug of like, maybe I should start doing something, and so, pickleball's a big thing that's coming along, but there's other sports that people are getting into. And that cross training aspect comes in big when you come into that, like you haven't been active for a long time, or maybe just not active enough to prevent those, weekend warrior injuries, right?
You hit the nail on the head. It's weekend warrior injuries. We want to go from the business chair, your desk, your workstation, and then you want to be able to play 45 minutes to an hour on a Saturday or Sunday.
Right.
And yet you've done nothing to prepare. And people, if you look at the evolution of how we got to pickleball, think about it. Tennis, racquetball, paddle, pickle. It's that evolution of that ballistic, that speed, that rotation as we start to progress in our age. and in our function. But most people don't understand, no matter what the sport is, especially racket sports, you have to be prepared for the activity. And many people never work their core. They never work the core. And you as an athlete understand the importance of your core. If your core is not strong, you're ultimately going to hurt yourself. If your core is not strong, you're going to hurt your low back. But most times you're going to hurt your shoulder or your hip because you're not rotating appropriately, because you don't have the dynamic functionality and strength. So people have to understand that it's not just that hour or two a week that you're competing. What are you doing during the week to condition aerobically, anaerobically, as I said, core strengthening programs, understanding the dynamic and ballistic component of any paddle sport or racket sport. So it's the easiest way to keep injuries down is train for what you want to be able to accomplish. Just like physical therapy, we train people based on their goals. My goal is to play pickleball and not get hurt, which is why I'm playing pickleball instead of playing racquetball or instead of playing paddle or tennis. I'm going to play pickleball. It's still competitive. It's giving me an opportunity to engage, to socialize. Why do I want to end up in John Gallucci's office at Jag 1 Physical Therapy? Because I didn't continually train myself and condition myself. So that's probably the biggest thing. But we are seeing a lot of injuries in pickleball. And if you look at them, they're usually overused musculoskeletal injuries or a ballistic movement that the body was not used to making. And you cause a soft tissue injury of your hamstring, your quadriceps, your groin, your abdominal. So we are seeing an increase of musculoskeletal injuries in totality. And usually it's because of a deconditioned individual trying to participate in a sport.
Right. Because your brain tells you, oh, you can still do this, but your body's not ready for it.
Our brain tells us we could do a lot of things. I mean, I was a wrestler my entire life. I wrestled. And a couple of weeks ago, I happened to be at a school that I coached at for years. And I was joking around with a couple of the kids. The next day, I felt it and realized I train every day, but I'm not training for wrestling. So literally, I did a couple of things just with a couple of the athletes. And the next 2 days, I was sore because I was not conditioned for the sport of wrestling. I'm conditioned to be able to get on a bike and ride 25 miles. I'm conditioned to be able to jog 3 miles. I'm strong enough to deal with my activities of daily living, but I was not ready to just joke around and do some wrestling moves. And the next 2 days showed I wasn't conditioning for wrestling. And pickleball is the same thing. Any sport, tennis is the same thing. I mean, you can't run a marathon unless you condition for it. One of the biggest things we get are the above 40 athlete that still thinks they're 18 to 25 years old and want to compete. The funniest thing is when you have people come into my office, they'll actually say, I was on a fast break against this 23-year-old. And meanwhile, you're in my office. Yes, I know you scored. I can't tell you scored the 2 points, but you're in my office. The 23-year-old is still running sprints down the court. So,
so how do we go from, not being active or not being in that activity? Like you said, you're active, but you weren't in wrestling. Like, how do we know where that guideline is or where that sort of boundary is to stair step into that?
Jerry, that's a great question. And the best way to do it is understand the demands of the sport. So we've been talking about pickleball, and we'll use pickleball as an example. We know that there's a component of rotation. We know there's a component of using your shoulder. We know there's a component of the entire body functioning together, moving up and down the court. So you need to be able to condition the entire body appropriately. And as we talked about it, there needs to be an aerobic component. Are you doing some jogs or cycling or swimming just to build up your aerobic capacity? And then are you doing some general strengthening exercises for your core, for your lower extremities or your legs, for your upper extremities and arms? There's so many simple tools. You can find it on our website at jag1pt.com. Simple exercises for people to do each and every day at home. And then the other thing is most people don't realize the importance of nutrition, hydration, and rest. So again, people want to go to work all day. They want to drink their 1 to 2 cups of coffee. They rarely drink appropriate water. They may have had a project at work that kept them up. So maybe they only got 5 hours of sleep versus 8 hours of sleep. They had to take care of their kids. They're running around. They don't eat appropriately. They take a bite on the end. Then you go and play and you're 30 minutes and you're feeling great. Then all of a sudden you feel that tightness in your calf and it becomes a cramp and you're like, oh, it's okay. And then all of a sudden you strain your calf and you tear your Achilles. And a lot of people don't realize the importance of the nutrition, the rest, and the hydration. So I tell everybody in the morning, the first thing you do, everybody grabs the cup of coffee or grabs the orange juice. I tell everybody, first thing, grab an 8-ounce glass of water.
Yep.
And make sure if you're going to have coffee at work, at lunch, you have another glass of water. And around dinner time, you have another glass of water. And before you participate, have another glass of water. So you know you're appropriately hydrated for the demands of any sport. So that's very important. A lot of people miss that part. They think it's all about strengthening, flexibility, conditioning aerobically. Yes, but what goes in has to help charge the body and get you going.
Yep.
So
no, that's very true. And one of the things that my dad was a veterinary pathologist, but as I was an athlete growing up, one of the things he stressed more than anything else was that make sure you're hydrated 3 hours before. He said, because if you wait until like the last minute to do all your hydration, it's not going to help you because it's not going to get where you need it to go. So you've got to make sure, like you said, all throughout the day that you're continually hydrating so that when you go to be active, it's there to be helpful.
Your dad was 100% correct. And think about the worlds that I've worked in. Hockey with the NHL, Major League Soccer with, in soccer. I worked in wrestling as a coach and a wrestler, very high endurance. I deal with running athletes all the time, NFL athletes. I deal with athletes trying to compete in colleges across the country. And ultimately, when you look at that component of dehydration and how it affects the musculoskeletal system, you sit there and you say to yourself, the simplest thing, putting fluid in your body can decrease an injury and keep you on the field, the ice, the mat, the court. So it's very important. And going back to our weekend warriors, it's the last thing we think of. We're just pumped. We're back on a team. We're going to compete. This is great. We're going to win the club championship. I mean, I belong to a club here in New Jersey, and I'm with successful people that are all jonesed up that they won the club championship. But at the end of the day, if you're going to be in my office for 8 weeks because you tore your hamstring, I think it's great. You got that championship T-shirt, but how's your hamstring? Let's stay on the court. Let's stay on the field. Let's enjoy the whole year in being healthy.
Yeah. Well, and also the fact of like, now that we're adults and we have jobs and you go out and you hurt yourself on the weekend, that's going to affect your productivity. No matter what you do, it's going to affect your productivity because you're thinking about it. You're focused on it. You're maybe down on yourself because you allowed yourself to get hurt, and so that affects your productivity for the next 2 to 3 weeks even.
The psychosocial component is huge. Plus, nobody wants to be in pain.
Right.
Think about it. Nobody wants to be in pain. And here in America, we look for the quick fix of pain.
Right.
The simplest way to decrease pain is movement and function. And as long as you're not inhibiting it, you'll be able to get rid of the pain quickly.
Right. Well, and that's one of the things I wanted to talk on is physical therapy as a pain management or an alternative to just taking some pain meds because it'll mask it, but it doesn't fix it. So it doesn't really go away. And I mean, I know I've been there at times where it's like, I don't have time for physical therapy right now, or I don't. And so it's like, okay, just take some medicine. And then I'm not feeling the pain, but my injury's not healing properly.
Well, that's a great question. And ultimately the issue is you're taking the magic pill, whatever the doctor may give you, or you may pick up something, an over-the-counter medicine and take it, and you have some decreased symptoms.
Right.
And I love the fact that people say, well, I could walk 10 feet with no pain. I'm good to go run 3 miles, or I'm good to go play the pickup football game, or hey, I went up the stairs and had no pain. I'm going to go play an hour of tennis. Ultimately, it doesn't work like that. The body has to be reconditioned after injury. And if you have pain, you have an injury. So you need to take a slower approach. First of all, think about it. Most of us are paying to play sports. We're not getting paid. We're not making our living out of this. We're paying. So all my golf friends, I tell them all the time, none of us are getting a PGA check. Yeah. So let's take the pace down. We can still be competitive, but let's be smart. I mean, I had a friend of mine the other day on the side of a hill trying to get out of a sand trap, and he took his first stroke and he fell on his back. And I said, really? You couldn't have just taken it out, not hurt yourself and taken the stroke? But people are so competitive, which is great. But when we get back to pain, we have to understand physical therapy is the easiest way not to go down the opioid utilization route. It's published studies across our country. The government has acknowledged that physical therapy is the path of reduction of pain instead of medication and opioid utilization. So when you look at what does a physical therapist do? Well, first and foremost, we have modalities to help reduce pain by increasing circulation, promoting good blood flow to the area, healing the tissue by good oxygenated blood. And then what have we been getting told since we were in phys ed class in 5th grade? If you don't use it, you're going to lose it. Well, what does physical therapy do? We bring back normal range of motion, normal strength, normal functionality, and biomechanical chain movement. And now we bring you back to the demand of the sport. So we take you from that pain point to full back to what you've got to accomplish. And I said earlier, some people look at me as just a sports medicine guy. I've treated firemen, policemen, painters. The best thing is I had an NHL all-star next to a 72-year-old grandmother with a total knee. And they were pushing each other in their exercises. It was awesome because she had a goal to be able to kneel and work in her flower bed. And he had a goal of scoring goals in the NHL. And he's still playing today, so I must have done a good job. But anyway, people have to understand there's a pathway to return. And if you don't have the elasticity in the musculature, if you don't have the appropriate range of motion of the joint, if you don't have the strength for the demand of the activity, you're ultimately going to get injured or re-injured and still not be able to perform. And go back to that psychosocial component. I know I'm on the bike every single day. It helps me stay level psychologically. It helps me stay fit. And I miss that day of the bike, I get frustrated. Imagine if I couldn't bike for 2 to 3 weeks because I didn't take care of an injury. So just imagine some of these people that are using pickleball, paddle, tennis, basketball. I work with a great doctor friend of mine. He's on the tennis court 5 days a week. If he misses a day, he's a grumpy man. So we want to make sure that helps us. It decreases overall stress. Exercise is huge for the human body. And more people have to understand that.
No, that's very true. My wife will tell me if I don't run in the morning, she'll by the end of the day, she's like, "Did you run today? Because something's off." And yeah, in the times that I've been injured and had to sit out for a month or more, I've had to find a different with this injury, I can ride the bike, so I'm going to ride the bike. But to get that same psychological benefit, it's 2 or 3 times the amount that I would normally run, and so my time of exercise is increased, and it affects the whole day. And when a lot of times it's just a matter of okay, if I would have just taken care of myself when I saw it coming or felt it coming instead of ignoring it, then it would have solved a lot of issues that came up later down the road.
Well, isn't it better to be on the pickleball court, the basketball court, the tennis court, the golf course, than sitting on one of my tables at Jag 1 Physical Therapy?
Right.
We're great people. We're really, really nice people. But wouldn't you rather be playing with your friends than hanging out with my really kind physical therapists and athletic trainers? Although our doors are open, but let's do it together and collaborate and do it the right way. Right.
And catching it before it gets too bad.
Correct.
Because like you said, if it's a muscular injury and it's, I think I can play through it or whatever, it's eventually going to get into the joint and then it's going to mess up potentially other joints because your compensation is going to be off. That was actually what happened to me with my last injury. Is just my hamstring was just a little tight, but I was like, it's not that bad. I'm not running that hard right now. I'm just training through it. And then all of a sudden my knee started acting up and I was like, what is going on? What is the deal? And I go to my therapist and they were like, I said, the pain's here in my knee. And she's working on it back and she goes, no, your issue's in your glute.
Yeah, that's right.
I was like, dang it. How'd I let that happen?
Well, how many people, I mean, if you look at runners and cyclists and any type of racket sport player, don't understand the component of their IT band
Right.
and how it relates to your hip and your knee. And everybody, we all learned again back in grammar school how to stretch our quad, how to stretch our hamstring. But nobody ever talked about stretching the calf, and nobody ever talked about stretching the IT band. And if you look at some of the leading causes of hip pain and knee pain, it's coming from your IT band, and good flexibility and taking care of it, very important.
Yep, very true. So, and I know that you've got 5 things that you don't know you're doing wrong that you talk to people about. So what are those 5 things that the average person doesn't know that they're doing wrong and needs to fix?
So the first thing is a lot of us are working from home. Right. And ultimately, one of the easiest things to fix is the desk chair or your setup for working home. Most people don't understand that they'll sit on their couch for long periods of time, have stiffness in their low back. You need to be sitting in a chair where your knees are at 90 degrees, your feet are flat, your hips are at 90 degrees, a good supportive back, and you're making sure that your screen is eye level. So those are 2 tips, one for your low back, one for your neck. If your screen is eye level and you're not rotated or looking down, you're not going to get neck pain. If your chair is appropriate and your hips or knees are aligned, you're not going to get low back pain. The other tip that I always give is come out of the gate a little slower. Too much, too quick, puts you in my office quicker. So if you decide you're going to take up running, the first day you run shouldn't be a 5-mile sprint. How about we go for a nice mild jog and build up on a week-to-week pattern? Usually you see the quickness of rapid causes patella tendonitis, Achilles tendonitis. So the third tip is to truly take it out of the gate slow. The 4th tip is very important, and I already touched on it a little bit, is hydration. We don't realize how important hydration is to our systems of our body, but more importantly to the muscles of our body. It's very, very important. And then the last tip is an odd one, especially for a sports medicine guy. All of you do it at home, folks. Do it yourself projects. I'm going to hang shelves. I'm going to paint the room. I'm going to spackle. Again, it's that same philosophy. Are you ready for the demand of taking a screwdriver and rotating it 100 times to hang the shelf? Are you ready to paint 100 times? So take it slow. Don't put time parameters on your project. Some of you are doing projects to decrease stress. So you're going to hang shelves. I'm going to hang 4 shelves. Who says they have to be hung in 30 minutes? You're the boss at home. They don't have to be hung in 30 minutes. Let's make sure you're stretching out your forearm, making sure you're stretching out your shoulder, making sure you're warmed up for the demand. Again, we see so many people coming and it's usually on Mondays and Tuesdays, coming into our offices at Jag One because they did a do-it-yourself project and ultimately tried to bang it out in an hour. I had a local friend here in New Jersey who went into complete back spasm because he decided that he was going to rake his entire lawn, bag the leaves, and he was going to use it as a fitness thing, and he was going to do it as quick as he could possibly do it.
Gosh.
Well, he did it as quick as he could possibly do it. Sunday morning, he called me up. He couldn't get out of bed, and luckily, he lives by one of my offices. I met him in the office, and he was all in spasm because he was not ready, he was not warmed up, and people have to understand. So those are the 5 important things. And people say, John, you're a horrible businessman. You just told 5 things to keep people out of your office. Well, I'd rather see people happy and healthy and participating in the things they want to do. And that's why I got into this world of rehabilitation.
Yeah. Well, and there's always going to be injuries. Like, even if you do all the precautions, there's always going to be something where you just step wrong or,
accidents happen.
Yeah. And so, it's one of those things that I think that's the other piece that where physical therapy is necessary and shouldn't be something that people look at and go like, oh, they're gonna push me too hard. They're gonna make me hurt. They're gonna, you might get it might be painful to go in and have your body stretched a certain way because you're, like you said, you're in spasm. And so like if you don't, it's gonna get worse the other way.
And the therapist you're working to has to collaborate and listen to the feedback
Right.
of the patient.
Right.
And that's one thing we teach our physical therapists each and every day. Make sure there's a communication because everybody is different.
Right.
And as we like to say, we're people treating people. So just as you want to be treated, you have to treat those that you're treating. And it's very important to understand that dynamic of engagement because you have to listen to what's happening to the patient. And a perfect example is, and again, I bring it back to pickleball where we started. You've got a patient that comes in with back spasms. They're telling you they have a tournament on Saturday they want to play. It's Monday.
Yeah.
Well, you've got to be able to be smart enough to work with the patient on Friday and tell them if you think they can go or not. And if they can't, you have to help them make that hard decision. You're not going to play in the championship day, but hey, you're not going to hurt yourself further. And it's that communication, it's that give and take. And we teach our therapists that each and every day.
And that's great. And one of my injuries I had, it was 6.5 years ago, is like water skiing. I've been a water skier all my life and I'm in great shape. And I was like, you know what? I've always wanted to try this trick. I'm going to try this trick. And I tried to do a wake helicopter. I jumped up off the wake, spun around. And as my brother-in-law who was watching from the shoreline said, one leg made it 360 and the other went about 310. Caught and the ski didn't come off. My knee hit the water at full force, shattered my my PCL and grade 3 MCL, and that happened in July. And I had already signed up for a marathon in December, and I was like, and so I was like, okay, I think I could do a half marathon. I think I can come back for that. And when I went in for physical therapy, for my evaluation, I showed up in my running shorts. I'm like, let's go. This is a week after the accident. Let's go. Let's just get this going. I've got a goal in place. And the therapist actually looked at me after he evaluated everything. And he looked at me and he says, I can't be your therapist. And I was shocked. And I was like, what? I was like, what? Like, because the way he said it was almost like you're too far gone. Like you don't need and I was like, what? And he goes, no, I've never played competitive sports. And so your goal of running a half marathon in 5 months, I don't understand that. So we're going to put you with somebody else. And then somebody else in the group had run collegiate cross country. And so she was like, I think you're nuts, but let's see if we can do it.
Let's say we do it. Right. Again, it's managing those expectations.
Yeah. And I did something which is another thing I wanted to touch on is that like understanding that when they give you homework, you got to do your homework. And so I was doing my homework religiously. And so when it came time, like I ran that half marathon and I didn't run a time that I wanted to. And of course I was fully braced up and I made it about 8 miles at the pace I wanted to. And then my body just gave out because I just didn't have the training to last for 13.
Yeah.
And my leg was numb when I finished and everything, but I finished, which was the huge piece.
It was a triumph, but understand you hit the nail on the head. And I might use you for one of our commercials. You have to do the homework.
Right.
Realize when you're seeing a physical therapist, you're seeing them 2 or 3 times a week for an hour to an hour and a half, depending upon your injury. Those days off, you need to continue the functionality and the strengthening because that's what's going to get you fully back. Right. And most people don't understand the importance. In fact, I'm going to use the clip that you said that you have to do your homework. Mm-hmm. And most people don't understand that. And I appreciate you saying that. Everybody thinks a physical therapist, 3 hours a week isn't what's healing you. It's that collaboration that you're doing the things at home and you're doing the stuff with us. And that's what's going to get you back. So thank you for saying that.
Well, and I mean, I obviously I got that from being a collegiate athlete and being in the athletic trainer's office and them being like, no, you have to do this. You're going to come in here. You're going to do it, and I was like, I learned pretty quickly. Well, the more that I do of the things they give me, not trying to go too far in advance and not trying to push myself too far, but the more repetition I can do, the stronger I'm going to build everything, and the quicker I'm going to be able to get back to what I want to do.
Agreed.
Yep. And so when you're dealing with, obviously, as you talked about, you've dealt with a lot of athletes from all different levels, and then, people that are not athletes that have injuries from other reasons. Like, what's something that you see athletes do with their injuries that maybe makes them a little more successful that you wish that the other segment of the population would understand and start to do? Is there something?
So again, going back to what you said earlier, most people don't realize when you're in a professional organization, or you're even at a collegiate level, or even a really good, strong high school level or club level, there's attention by medical professionals every day.
Mm-hmm.
And so you go back to your athletic training component. Every day when you're in a college setting or a pro level, there's a physical therapist, athletic trainer collaborating, usually in the pro level, with a nutritionist, the physician, making sure that the massage therapist, making sure there's a continuance of care. As we look at the general population of weekend warriors, athletes that are competitive in other sports but just aren't professional sports, or people trying to get back to work or function, just being able to walk 10 feet without pain, whatever it may be, whatever your goal is, it's important that there is something done after you leave the physical therapist's office. It's very important that you're doing the stuff that the physical therapist, the athletic trainer asks you to do at home. And understand, a non-compliant patient is going to be one that, unfortunately, the length of stay in treatment is going to be longer. The compliant patient, of course, with no anomalies or secondary diagnoses, are ultimately going to return back to function no matter what it is, play, work, whatever it is. They're going to return back to function safer. They're going to return back to work stronger, and they're going to return back with no issues or pain. And that's an important thing that people have to understand. It's a collaborative, but we can't go home with you. We can call you, we can ask you questions, but we can't go. We could, Zoom with you. But ultimately, if you're not doing the work at home, you're not going to progress. And most people don't understand. And a perfect example is if you see some of the athletes I take care of in Major League Soccer and the NHL, they'll say, John, I saw you took care of this guy's hamstring. Within 2.5 weeks, he was back to playing. I'm 3 weeks in. What's going on? Well, first of all, there's different degrees of injury.
Sure.
Second of all, this guy is an individual that's training each and every day with a nutritional team, a strength and conditioning team, a performance team. You're coming into my office. I'm asking you to do these things. Are you doing them? And usually when the light bulb goes off, but also everybody is injured differently. Everybody thinks a hamstring injury is just a hamstring injury. Well, there's 3 levels of a hamstring injury, and the 3rd level is not a good one. You're not getting back in 3 weeks. So people have to understand what is the grade of their injury and getting a true evaluation. So what I would love for the populace is to understand education is awesome. You have to understand what is your diagnosis, what is the treatment plan, and trust your clinician to take you through that path. And as long as you understand that, the relationship's going to be much stronger. And a perfect example is, as you know, ACLs are huge in sports across the world. And ultimately, everybody philosophically thinks, oh, I could be back from an ACL within 3 to 6 months. Not if you're a competitive athlete. I mean, I'll show you research articles that you should not be fully functional, full return to play until 8 or 9 months. And I'll show you 10 studies that prove that's the length of time you should take. But you'll be shocked that mom and dad walk in the clinic and say, hey, listen, it's August 1st. Basketball tryouts are November 1st. Johnny or Susie is ready to go, right? And you've got to sit there and you've got to give them the research, you got to educate them, and then you get that buy-in of understanding, oh, this is going to be the length of time, and truly take it from there. So, and that's not saying with an ACL you're not functional at 4 to 6 months. Sure. It's just that the biology of the tissue has to heal, and you have to make sure so you don't get a reoccurrence. And the incidence of reoccurrence decreases tremendously when you hit that 8 to 9 month.
Well, and
I know you covered a lot, but I wanted to make sure I got it all.
No, well, you hit one that I've seen multiple athletes, because I coach privately, and so I coach athletes, and I've seen whether it's athletes that I've coached or their friends, or they'll tell me stories of so and so had an ACL injury in their game, and I'm like, okay, and then I hear a year and a half later, oh, they tore their ACL again, and I'm like, yeah, they came back. Most likely, they came back too quickly. Obviously there can be fluke things where it happens again, but if they've done the surgery right, like that should be stronger joint, and then it's just a matter of healing properly and taking the time to heal properly. Correct?
Yep. I had a college athlete in here 2 weeks ago, and he just finished his rehab of an ACL meniscectomy. Did really, really well. Met all the different goals that he had to make. So he didn't play at all this year. He was cleared 2 weeks ago by his physician, by me, that he could return to full play. Mm-hmm. But everybody thinks that's going to a game. So He was like, oh, great, we made the playoffs. I'm going to play this Saturday. Now, this was a Wednesday. And he goes, oh, I'm going to play Saturday. And I said, you haven't been in practice in a year. You haven't taken a hit in a year. You haven't moved and functioned on a field in a year. Mm-hmm. You've got at least 30 days of conditioning on the field and working within your position before you can think about it. And he went back to school and he told the coach, hey, coach, I'm cleared. And the coach laughed at him. The coach told him exactly what I did. He goes, hey, I'm glad you're healthy, but you're not playing Saturday. I look forward to you wearing your jersey and cheering for your teammates.
Right.
So at least the coaches are getting more and more educated, and the coaches are protecting their athletes more and more each and every day, which is awesome. Because that collaboration with the physical therapist, athletic trainer, the coaches, and the parents is so important with the youth athletes.
Yeah. Well, and from that competitive side that you've touched on several times, is that like once we get our mind set on something, okay, I just got to do it, like that competitive side. And so you do have to have, and so when I was injured with my knee, like, the physical therapist was like, I think we can do it. The orthopedic surgeon was like, I told you no surgery at the beginning, but I think maybe we need to do surgery. And I was like, I need a second opinion. And so I went to my old college, orthopedic surgeon, and, went out of town, went back to him. And I said, and he looked at me straight up and he goes, why are you here? And I said, well, I need to, he goes, no, but you're fine. Like, I looked at all your stuff. I looked at your PT stuff. Like, you're fine. You're progressing. Why are you here? I said, oh, well, my wife actually wants permission for me to run this race in 2 months. And he looked at her and he goes, if he wears the brace, he can run the race.
There you go.
I was like, all right, perfect. He goes, but just like you said, he said, if you feel pain, you have to stop. He's like, because there's something else that could be wrong. And so I had to, obviously I had that border and I kept on to it. And now I'm 6.5 years later. And, I'm past the point where I was then, as far as, or before pre-injury. I'm now beyond that point. My knee's still, no surgery. I'm still, I can't do certain activities without my brace on. And so I'm smart about that from a cross training standpoint. But I'm able to run without it. And all because listening and doing all the things. And like you said, I mean, it was over a year before I ran without my brace on.
Well, that's awesome. And it sounds like you, listen to your physical therapist, but more importantly, you listen to your wife.
Right. But one of the other things you touched on was that all injuries are different, and people need to understand that. And I think that is a big key.
People are different too.
Right.
Treating you who's training every day versus treating somebody with the same injury that's not conditioned in training are two different people. Also, people have different pain thresholds. Right. So you have to understand that. That's why we like to say we're people treating people, and you have to be able to engage with the individual.
And I think that's one of the biggest things from a person who's injured coming into therapy has to ground themselves in, is that it doesn't matter what anybody else's timeline is. This
Yep.
is my timeline. And like you said, I have to work with my therapist. I have to work with my doctor. I have to work with anybody else who's on my health team to make sure that my timeline is my timeline.
Correct. You got to make that plan with your physical therapist and athletic trainer, and you guys got to follow it together. And as long as there's good communication through the peaks and valleys of rehab, you'll have an outstanding outcome.
Yep. Well, I want to give you a little chance to, I know you've got a couple of books that you've written, and like to plug those and plug, anything else you want to before we end this recording.
Well, thank you. I appreciate that. We actually have a new book that's coming out that'll hit the shelves pretty soon, hopefully in the next 2 months. And it's basically some words of wisdom on entrepreneurialism and my trials and tribulations of dealing with athletes and life, and kind of getting some great opportunities and educational quotes out of that. And I've got a great forward by the legendary NBA player Armand Hill, who's coached at the
nice.
Celtics and is coached at the Clippers. So we're excited about that. And then I have a soccer injury prevention and injury book for any level of soccer player, let it be from the youth sports. It's a great book for parents knowing what to do with their children, but more importantly for high schoolers and collegiate players on a conditioning program. And then I had the opportunity to write a book on baseball injuries. We like to say baseball, softball injuries because they're very common, with
Right.
Chris Ahmad, the New York Yankees team physician. So we have that book. It's called Play Ball. So we're very excited about that. And listen, I can't thank you enough for the opportunity. And if anybody ever needs any information on any way to take care of themselves or direction, I have people, because of my relationships in pro sports across the world. And you could always reach me at info@jag1pt.com. info@JAGONEPT.com. And I appreciate the opportunity.
Yeah, it's been great. I really appreciate it. And I will link, all the information so they can get to you really quickly through the show notes. So,
Awesome.
Thanks, John.
This was great.